Good morning, everybody. And first of all, I would like to thank AOS for giving us this opportunity. So without much of a delay, I would like to start off with my presentation for today, which is the interpretation of Pentacam. So I'm Dr. Sanjana. I'm working as a cornea refractive consultant at Dr. Agarwal's Eye Hospital, Bangalore. Now, to start with the Pentacam interpretation, so firstly, we all know that Pentacam uses a rotating shine flood camera, and it has a light source of UV-free blue light, which emitting diode, and it captures about 50 images of the anterior segment in 2 seconds, and takes into consideration about 138,000 elevation points from the front and the back of cornea, and takes the entire image from limbus to limbus, including the center of the pupil. Now, when we look at the interpretation of the scans, now, first of all, basically we have different types of scans which are available. Now, most common what we take into consideration probably for a refractive surgery screening, etc., is the 4-map refractive. We also have other maps such as the Berlin Ambrosia display. Then we have the refractive map, etc. I will be covering about those also shortly. Now, firstly, talking about the 4-map refractive. Now, this is a picture of 4-map refractive Pentacam scan, which mainly has got 4 scans. That is, the first is the anterior or the sagittal curvature map. Then we have the elevation map, that is a front elevation, and we have the back elevation map, and then we have the thickness map. Now, even before we go ahead with the interpretation of the scans, we should always first look at what is called QS, which is here, which is called the quality specification. Now, if it says okay, that means the scan is of a good quality and we can go ahead with interpretation. In case there are some data gaps which represents in yellow or red, that means the scan is not of a good quality and it's better to repeat it. Now, the next thing is we look at the K values. Now, here we have the blue, which is represented by the flatter K, and the red indicates the steeper K. And also, it's worthwhile at the same time to look at something called K max, which is mentioned over here. Now, the K max, again, we have a cutoff value of 47.2, and anything less than that is considered to be normal. Now, these K values are represented in this map as well, which is an anterior sagittal curvature map. Now, here we have the red, which is indicating the steeper axis, and then we have the blue, which is indicating the flatter axis. Now, in this case, basically, it's the vertical axis steeper and the horizontal is flatter. So this is a with the rule astigmatism. Now in this, again, we have to look at the superior values and the inferior value. And again, whenever we are concentrating on interpretation of these, our main concern is mainly in the 3 mm and the 5 mm zone, and maximum up to 7 mm. This is where the maximum changes is what we see in the scan. So here we can see that the superior is the steeper axis that compared to the inferior. So there is some amount of superior inferior asymmetry which is seen. Now, it's worthwhile to mention here also that what would be the normal difference between the inferior superior asymmetry or the superior inferior asymmetry. Now, in this case, as we see here, the superior one is more steeper than the inferior. So the difference between the superior inferior asymmetry should be lesser than 2.5. Anything more than that is considered to be abnormal. And in cases where the inferior axis is more steeper than the superior, in such cases, the difference should be lesser than 1.4 to consider it to be normal. Now, the next thing is basically I already mentioned about the Kmax. So 47.2 is what we consider as cutoff. Now, the next one is moving on to the elevation map. Now, the elevation map, as I said, this is supposed to be the anterior elevation map, and this is the posterior elevation map. Now, even before we again interpret this, it's also important to look at what is mentioned over here. This is called, So this is basically the BFS, which is the best fit sphere. So we need to look whether it's in the best fit sphere mode or the best fit toric ellipsoid, because the values in the interpretation will be different accordingly. Now, in the scan, we see it is in the best fit sphere mode. Now, first of all, to understand what exactly is this elevation map, so I think Dr. Shana has already mentioned about the best fit sphere and what are how to interpret that. So just briefly talking about the same. Now, the yellow one, what we represent here is the best fit sphere, and let's assume this triangular thing is. Let's assume the triangular thing is the cornea. So when we see what is that portion of the cornea in relation to the best fit sphere, we see that this area of the cornea is above the best fit sphere, and this will be indicated as a positive island of elevation, and which will be represented by a warmer color like red or yellow. And if we look at this portion, this is actually below the best fit sphere, and this is called as a negative ring. So the negative ring or negative island will be usually represented by cooler colors such as green and blue. So now again, when we look at this, so we have got certain values. So again, we take into consideration the 5 millimeter zone, which is more important. Now in this, we have got certain values which are in plus, which indicates that this is above the BFS, and certain values which are in minus, which indicates which is below the BFS. And again, there are some multiple values which are mentioned here. We need to know what are the normal values. And this again depends on whether we choose a BFS or the best fit toric ellipsoid mode. Now, if we're choosing the best fit sphere mode, we have the cutoff values here. That is, in cases of anterior, it should be lesser than or equal to 8, and posterior should be lesser than or equal to 18. Now, again, if we're interpreting a hyperopic scan, then usually the values for anterior and posterior are 7 and 28 respectively. Now, if we choose a best fit toric ellipsoid, then usually the cutoff value would be for anterior is 12 and for posterior more than 15 is considered to be abnormal. Now, just to look at this, for example, here we see that there are some values like plus 20, plus 17. And so this is a front elevation map. So these are definitely values of more than 12, which indicates that there is some amount of steepening or other elevation which is being seen abnormally on the anterior float. Now, when we talk about the elevation maps, it's also worthwhile to look at what is called as a Berlin-Ambrosio display. Now, this is a very important map, especially it helps a lot in cases of refractive surgery screening, because the type of refractive surgery that we would be choosing definitely also depends upon what is the interpretation of these scans. Now, here we have mainly the anterior elevation, and then we have the posterior elevation map. Now, we have the middle one, which is actually called as an exclusion map. This exclusion map is basically formed when about 3 millimeters around the steepest axis is being excluded, and an exaggerated map is being taken. And the third one is what is called as a difference map, which takes into consideration the difference between the two and forms a picture this way. Now, it is more important to look at this difference map. And again, there are certain values mentioned over here. If everything is in green, that means the difference is less than 5 and it's considered to be normal. Anything which is about 5 to 7 will be represented by yellow. And anything more than 7, if the difference is seen, it is represented in red. So this is definitely considered as abnormal, as in there is some amount of anterior and posterior elevation which is seen significantly. So we have to be more careful while choosing the type of refractive surgery for such patients. And also here again, it's important to look at these values where we see the DF, DB, DP, DT. And what is more important is the final D value. Now the final D value, usually we have a range of 1.5 to 3. Anything which is more than 3 is considered to be abnormal. But in the range of 1.5 to 3 is again borderline and will be represented in yellow. And less than 1.5 is considered to be normal. So the next is moving on to the Pacumetric map. Now in the Pacumetric map, basically this is the corneal thickness of the Pacumetric map. And also we have the values of this which are mentioned over here on the left side. Now we have different things as in the pachymetry at the pupillary center, and we have pachymetry at the pachymetry at the apex. Then we have the thinnest location. Now, what is more important for us, especially for refractive surgery planning, is a thinnest pachymetry. And in this case, we see the thinnest pachymetry is 551. Now, in this map, again, it's very important to look at the values in the superior and the inferior part, especially in the 5 millimeter zone. So here we see that this is actually the 5 millimeter zone, and the superior value is 630 and inferior is 591. Now, normally the difference at this point, superior to inferior, should be lesser than 30. Anything more than 30 is again considered to be suspicious. And another thing important to look at in the pachymetric map is the y coordinate of the thinnest pachy. Now here we see that the y coordinate is minus 0.3. So any value considered less than 0.5 is considered as normal, but if it's more than 0.5, it's again suspicious, especially in cases of keratoconus, we do see values more than 0.5. Again, talking about the pachymetry, the certain information is also available about the pachymetry on the Berlin-Ambrosia display. We have something called as, this is a CTSP, which is called as a corneal thickness spatial profile. And we have the PTI, which is called as the percentage thickness increase. Now, in CTSP, we do see that there is a red, which is representing what is the patient's scan interpretation. Now, normally we see that this should be coinciding with the center line. Now, the center line is considered as a normative data, and the above one and below one are actually two standard deviations above and below the normative data. So the patient's the scan or interpretation, which is represented in red, will usually coincide with the center line. And we usually see that it will coincide with this up to 6 millimeter. And beyond the 6 millimeter, we normally see a dip, indicating that the thickness increases from the center, and beyond 6 mm, the thickness becomes more than the central area. But if at all we see a dip early, like what is seen here, we see that the dip is seen much before 6 mm, like probably around like 3-4 mm, we see the dip. That means that the center part is much thinner in comparison with the periphery, and again, it's considered a little suspicious. And the same thing holds good for this as well. Now, the patient's data will be represented by red, which should coincide with the central data, and beyond 6 mm, there will be a dip normally seen. So this is how we see the normal, the 6 mm data, the 6 mm zone, and beyond which we see that there will be a dip in the map. Now, the next thing is also important that we need to look at certain indices over here. Now, this is basically what is called as the progression index. Now, we have the progression index minimum and the maximum, and also we have got the ART. So normally we can finally look at what is called as a ART, which is also called Ambrosio relational thickness. And each one has got a cutoff value. And if it is represented in normal, it will be usually in white. But if it is something borderline, it's in yellow. And beyond that, in the abnormal range, it goes to red. So just to mention the values, ART max, the cutoff is considered to be 339. And in case of, we also have something called ART average, where the cutoff is considered as 434. And another important thing is we have another map called as a refractive map. Now, in this refractive map, mainly we focus at these values. The rest of it is pretty much seen in the 4-map refractive as well. But here, what is more important is the center one, which are the indices. So we have multiple ones like the index of surface variance, index of vertical asymmetry, keratoconus index, etc. So these are mainly for the interpretation of keratoconus. And again, these are all, the values are already fed to the computer system, Pentacam system previously itself, and anything more than normal or in the borderline will represent itself in the form of colors like yellow and red. So this is just the values of all those indices, which will be represented as abnormal in yellow, and anything which is pathological will be represented in red. So not necessary that we have to remember these values as such, but we need to know that if something has been mentioned in red, that means it's abnormal, and we need to take a second look at it. And one more thing worthwhile to mention over here is the angle kappa. Now, we know that the angle kappa is basically the angle between the visual axis and the pupil center. Now, in OBSCAN, usually angle kappa is being mentioned directly, but in Pentacam, we do not get a direct value of angle kappa. So, but there is an indirect way of assessing. Now, when we look at this pachymetric map, we have something called as the pachymetry of the pupillary center. Now, we have to look at the x coordinate of the pupil center. And if this x coordinate is lesser than 0.2, that means to say that the angle kappa is less than 5 degrees. So anything more than 0.2 indicates that angle kappa is more than 5, though we do not know what would be the exact value, but at least roughly we'll know whether it's normal or high. Now, just we'll look at certain pathological maps. So whatever the basic interpretation that I've covered is just in the very basic that we need to know. Of course, there's a lot more to it, but these are the bare minimum that as residents or as general ophthalmologists should know to identify whether the scan is normal or it's abnormal. Now, let's look at this scan. So this is basically very, very clear that it's a case of keratoconus. Now, just to mention, when we look at this anterior sagittal curvature map, we see that there is steepening where the K values are very high. We see that it's about flatter axis is 52, steeper axis is 55, K max is 66, very steep cornea. And when we look at the anterior elevation map, we do see a very nice island in the center, which is values are higher than the normal, which indicates that this area is steeper and more elevated. and also coinciding with the posterior elevation map where the central value is again high. And these things are also coinciding with the thinnest brachy. So basically, it's a typical case of severe keratoconus. Now, when we look at the same Berlin-Ambrosio display of this, we do see that there is in the exclusion map and the difference map, we do see that there is the red area indicating that there is anterior and posterior elevation significantly. And also, when we look at all these D values, we see everything is represented in red, and the final D value where the cutoff is 3 is increased to 15, definitely highly abnormal. And when we look at this CTSP or the Pacumetric progression map, we do see that it's definitely abnormal, and there is very much thinning which is seen in the central part. And also the same thing when we interpret this in this particular map and looking at all the indices, we see all the indices are being mentioned in red. So this is typically a case of keratoconus, and sometimes it may not be quite obvious this way, but there will be values where there will be steepening and some areas being represented in red, some in yellow. So those things are to be taken a second look and see what exactly is wrong in those particular scans. Now, next is about this pellucid marginal degeneration. Now, this is where we can see in the sagittal or curvature map, there is a typical kissing bird sign, and this is against the rule astigmatism, and a very typical bell sign, which is seen on the Pacumetric map. And this will be associated with the inferior steepening, and there'll be thinning as well. Now, this is another map. Just if we grossly look at it, let's say we have got a refractive surgery planning for this patient. Now, when we grossly look at it, we do see that there is some amount of against the rule astigmatism. Anterior fluid seems to be fine, and the posterior just some small area which represents in yellow. And then we have got the pachymetry about 518. So in this case, overall, it may look okay, but when we closely look at it, we do see that the K max is actually 47.5, which is above the normal range. And when we look at this, there is a suspicious island. So it's always important to look at the elevation map more so for the posterior elevation, because that is where we need to concentrate on, especially for a refractive surgery planning. Now, let us look at the Berlin-Ambrosio display of the same map where we'll get a better detail of this. Now, when we see this, we do see a typical this thing on the posterior elevation map represented in red. We do see the difference map on the anterior also, which is showing red. So this indicates that there is definitely an anterior and posterior elevation which is beyond what is considered normal. We do see certain values in red and yellow as well. So these cases, and the pachymetry is also a little on a lower side, and again the K value, K max, is a little on a higher side. So again, taking into consideration the patient's age and also the power, etc., we need to be more careful when we choose these patients for refractive surgery. Now, similarly, we have another patient scan wherein see there's some amount of more superior steepening compared to inferior, and the anterior one seems to be fine, but again, the posterior, we do see that there is an elevation, and in this significant elevation, which is seen on the difference map, and the derangement in the D values as well. So such patients, we need to take a second look. Now, the next one is about this is basically very typical of a post-LASIK, where we see that the central area is in blue, very good flattening seen in the center, with all the values on the lesser side being 34, 35. And also we see that the pachymetry is on the lesser side coinciding with the flattening. So this is a case of post-LASIK. And we also have another one, which is in case of post-SMILE. Again, we do see a very good central flattening over here with the K values on the lesser side and decrease in the pachy. So these are some of the basic scans and the basics of the interpretation of the Pentacam. So here I would like to end my talk. If we have any questions or inquiries, we can take it forward.